Hi, I'm John Samuels, founder and CEO of Wellworth. Today we're here to talk about mental health and addiction. Often families who we work with have a hard time trying to understand the right treatment programs for their loved ones, the right levels of care, and the right types of programs and how they work. Mental health and addiction can often be very confusing and complicated compared to other parts of the healthcare system. So we're fortunate today to have an expert with us, Erin Royer, who is a senior outreach executive at Sabino Recovery. And she's going to shed some light with us and talk about some of the nuance and some of the what's happening behind the scenes around treatment facilities and how to find the right programs for loved ones. Welcome, Erin.
Thank you. Thank you for having me.
Erin is a behavioral health professional with nearly a decade of experience across intake, concierge treatment, program management, operations, and business development. Since 2015, she's built a well-rounded and strategic approach to helping individuals access the right care. Her early focus on criminal justice and victim advocacy shaped her commitment to this work, giving her a strong foundation navigating the complex mental health care system. She's head of clinical outreach at Sabino Recovery. Sabino Recovery is a premier residential treatment center that offers individualized care, addressing the true root causes of mental illness and addiction, often focusing on trauma, something that Sabino and Erin talks a lot about. Outside of work, Erin enjoys pickleball, live music, and spending time with her son at baseball games. Again, welcome, Erin. We're thrilled to have you here.
Thank you so much for having me.
So let's first talk a little bit about understanding the complicated field of mental health and addiction. What are the different levels of care in mental health and in addiction?
Right. So, to start off, hundreds and hundreds of treatment programs across the country, right? And so I think breaking down, like you said, the levels of care is important, starting with detox, right? So that's medically supervised care, helping residents or clients get tapered off of substances, comfort medications, right? It's short-term stabilization, usually between 5, sometimes upwards of 14 days, depending on the use. Next step would be residential level of care. So I think typically when you hear rehab, right, we're thinking of residential level of care. It's where clients are actually living on site, right? And so 24/7 clinical care, nursing care, but it is a step down from a more stabilization type of environment. Most residential programs, as you know, are voluntary and can range anywhere from 28 days upwards of 90 days typically. Step from there, PHP. Partial hospitalization program, so day programming. Essentially, you're living at home or in a sober living and you're attending throughout the day, 5 days a week. 4 to 8 hours a day, can last between 2 and 6 weeks. Again, we're probably going to talk a lot about insurance, so depending on what insurance will cover if you're utilizing it. From there, IOP, intensive outpatient. Ranges usually a minimum of 9 hours a week, 3 days a week. Morning, afternoon, evening. So folks who might be going to school or have a job that's 9 to 5 can go in the evening and still have that support. Again, wide range in terms of time frame, right? Can be anywhere, again, from another 4 to 6 weeks. Sometimes you can continue a lot longer. From there is OP, right? So outpatient. Typically 1 to 2 groups a week, followed by continuing to meet with your individual therapist and your prescriber, and maybe a bit more individualized, just this term, depending on like what your needs are. And
so, for the audience, you can see how complicated this is in that there's detox, there's inpatient rehab, there's inpatient, outpatient, stabilization programs, evaluation programs. And that's one of the reasons why we're here today to talk, because with this complexity is specialization, which is very good from my perspective, in that the treaters can be deep experts in all the fields that Erin articulated. But I think often families get confused with understanding which is the right program for them. So what do you see as the biggest common mistakes that families make when trying to choose one of these programs for a loved one?
Just logging into the internet, right? Google, ChatGPT, people are finding treatment programs now, which is all based on just summaries from websites and client reviews and experiences. And I know we'll probably touch on, as I imagine, how to look at reviews. But I think that's one of the biggest mistakes. Or you might have, a best friend's son went to this treatment center. They had a really, good experience. So I'm going to send my child there with, your child can have completely different needs and complexities than, your best friend's son. So I'd say just misinformation. And again, the amount of information out there can be really overwhelming. And
a double-edged sword, right? So it's great to have information. On the other hand, when we have too much, it becomes overwhelming, and it can really be, certainly be a challenge. Now, when you put your hat on from Sabino and other places you've worked at, how do treatment centers view who the right fit is for them? Because it has to be a match.
Yeah. I would say always starting with the rule outs, right? And so any program is going to try and identify, is there active eating disorder, active, psychiatric symptoms that they need a higher level of care for in inpatient setting? Are they on the sex offender registry list, right? Do they have, physical and aggressive behaviors? Have they been convicted of those behaviors before? I think it's once you've identified the treatment program, right, it's pretty self-explanatory what their type of screening process is. I know most folks will go through an intake process, right? Gather all of their history, medical history, current medications, figure out what some of their goals are for treatment. And then the clinical team will take a look at that and try to understand, can we help this individual? Do we have the capabilities to support this individual? And will this individual be a good fit in our current environment, right? And so I think that's super important. We want the community to feel safe. We want the incoming resident to feel safe. And there are other nuances that a clinical team is going to take a look at, right? If we've maxed out 30 beds in a 30-bed program and have somebody coming in and the current milieu is acute, right? They're difficult to manage. Can we bring in another resident who might impact that even further? Are we going to stretch our staff too thin?
And I think it's a really good point to bring up about the current milieu. And when we've worked together in the past, when Wellworth has worked with Sabino and your team, we've often talked about that. So that one thing for families to think about is who are the other types of individuals in treatment. Now, obviously, we need to be careful about HIPAA, and we're not asking for private protected health information, but understanding the type of challenges that others are struggling with during one's stay there can help match the right person in addition to who the treatment team is. Erin, what's a typical day like for clients?
Yeah, I think in a cookie cutter program, right? Wake up, morning medications, group, some type of movement activity, yoga, community meeting. Throughout the day, a lot of psychoeducation groups, some process groups. If you have an individual appointment that day, right? Perhaps you're meeting with an individual therapist or your psychiatric provider. Dinner, community, evening support groups, whatever pathway of recovery you might be choosing, what some different offerings might be. Sometimes, of course, in more specialized programs, right, when you're looking at some private pay options or an assessment program, right, you're going to have less psychoeducation groups, right, more process groups, and a lot more individualized sessions or individualized care.
And could you tell us what a process group would be? Give an example.
Yeah, so clinician-led, small. Instead of providing education, right, or, 12-step information. Really, they're trying to get into what you would typically get into in an individual therapy appointment, but in a group setting. So it can be really impactful.
And often there's discussion in this space about groups versus individualized treatment and the balance of that. There are some programs just groups, some programs that are heavily individualized. Tell us your thoughts about that dynamic a little bit.
Yeah, I mean, so often we'll get clients or all the families on the phone, no groups, like only one-on-one sessions, right? The group dynamic is so impactful, right? And I think there can sometimes be a negative stigma when it comes to group therapy, right? But you can learn a lot from your peers, right? And so in speaking on the current cohort, right, and some of the information we want to gather before we send somebody to a program with ages and diagnoses and what is the cohort looking like right now, I mean, you could have a 45-year-old, right, with the maturity level of an 18-year-old, right? You could have a 30-year-old's new dad be in the same process group as a 70-year-old grandfather, right? Who, you know, you're taking a look at, who might have a lot of life experience, or it's, you know, I don't want it to get that bad where I'm 70 years old in treatment and dealing with the shame and regret that this person is, right? And so when you think about that group and the therapeutic value of it, I love group therapy, clearly. However, you know, it does need to have that balance with the individualized care. And so you'll see it range between insurance-based programs and private pay programs with just how many individual sessions you might be getting.
And in addition, and like other things around mental health, I assume it's also contingent about who the facilitator is. Yes. And how many people are in the group and what they're working on.
Yeah. And so a lot of the times, right, again, you're asking those questions on the front end or trying to get a good sense of the cohort. I think we focus so much on ages, right, instead of trying to understand on the front end who is not a good fit for your program, to try to get a sense of the type of environment that typically exists there, right, or what the level of acuity there is at the time. So yeah, but it you know, with any residential or even PHP program, like there's admissions and there's discharges, right? And so you really just have to put your trust in the program's leadership, that they're creating an environment that's therapeutic for everyone there, right?
I'm often struck by individuals who need these kinds of treatment, often have decades of addictions and mental health at varying levels.
Yeah.
And there needs to be, from my perspective, sophisticated modalities to address this, and having group and individual and wellness and exercise and yoga and outdoor time and individual time and a variety of treaters. So taking that really sophisticated approach certainly does seem as if that the condition warrants that kind of approach, be it at IOP or PHP or inpatient.
Right.
Yeah, and you mentioned insurance.
Yeah.
So can you talk to us a little bit about which of these programs take insurance, which don't, and what some of these things cost?
Yeah, no, of course. So you have your in-network insurance-based programs, right? You have your out-of-network insurance-based programs, and then you have your self-pay or private pay programs. This is a tricky conversation, right? Because there are some private pay programs where you're paying for the luxury, right? You might be paying for the granite countertops or the in-ground pool, or to be on, beachside cliff in Malibu, right? And clinical might not be that sophisticated, right? But then you have private pay programs who are offering a variety of different evidence-based modalities, experientials, right? And who might have also some of the luxurious sides, right, that an individual might want, but you're really paying for the clinical services that are being offered, right? And comprehensive holistic care, because it's not just CBT or DBT or 12-step based programming, right? Like you said, you want to take a look at health and wellness and movement and experiential. With insurance-based programs, it's a little bit more cookie cutter, right? And that's just the reality. If any treatment program that's insurance-based tells you that insurance doesn't dictate treatment, they're being dishonest, because it does. That's just the unfortunate part of it, right? And so insurance will decide what level of care you're appropriate for, right? In terms of like outpatient, or if you meet medical criteria to be at a residential level of care. When it comes to process in treatment, how many days are you authorized to be there for, right? What happens when your days are no longer authorized? What's the next step? What does a treatment center do? And you are engaging in activities with providers that providers can bill for, right? And so when it comes to costs, right, you're looking at in-network coverage. If a plan, I know you know a lot about insurance, has out-of-network benefits, right? Like, what do we want to try meeting the out-of-network max and deductible and going to an out-of-network program where once we meet this, right, we're good for the rest of treatment and for the rest of the year, depending on when it is, right, for lower levels of care or higher levels of care. So I'd say insurance, again, covered in-network or out-of-network, where you have to meet your, deductible and out-of-pocket max. And then for private pay programs, they can range anywhere from, if you don't have insurance and you're going to an insurance-based program, it's usually about $1,000 a day, right? Upwards of, $90,000 to $200,000 for 28 to 35 days in treatment.
Yeah, and I've seen the sort of the intricacies of insurance, where insurance is applied and it covers, but insurance will pay, instead of $1,000 a day, $500 a day.
Yeah.
And what they consider reasonable and customary, right? So you could be in network, but the insurance ends up paying a very little part of the treatment.
Right.
And I have to say, so often in healthcare, the tail wags the dog, where insurance is dictating treatment. You need physical therapy and you get 2 visits a week. That's what insurance pays for. But maybe a patient with a broken hip would do better and heal faster and be out of pain quicker if they got physical therapy for 5 days consecutively in a week. So, having clinicians have the flexibility to let clinical lead around care and treatment and not be beholden to insurance seems like it certainly helps around outcomes and getting better care for folks. And nowhere, I think, is it more prevalent in insurance and mental health.
You're 100% right.
Yeah, and then when you talked earlier about the different levels of care, it seems, in addition to that, with insurance, sometimes insurance, and tell me if I'm right, sometimes insurance will cover IOP but not inpatient, or does that happen sometimes?
Yeah, quite often. You might be leaving a hospitalization, right? And your insurance is only, covering an intensive outpatient level of care, right? I know many amazing clinicians and programs, right, who will go to bat, right? If you're in an outpatient level of care and you need documentation and you're looking for single case agreements, right, to get an individual to the next level of care, like, they'll go to any limit to make those things happen, right? But again, it's putting that trust in those, clinical providers to make that happen.
Yeah. And let's just switch topics for a minute and talk a little bit about regulation.
Yeah.
And accreditation and things like that. In mental health and addiction, what is the landscape around regulation and accreditation?
Right. So every program has to be licensed in the state that they're in. That is a non-negotiable, right? When we take a look at accreditations, specifically, I'm thinking in the substance use field, right? There's CARF and Joint Commission. I look at it as the IRS of rehab, right? So if you're filing your taxes every year, every 3 years you're being audited, right? And so I know that it gives a lot of families and referring providers peace of mind that safety, regulation, right, is all up to standard, because you want those approvals, you want those certifications. And not only are you taking a look at, again, like safety, operationally, compliance, patient experience, patient outcomes every 3 years in these audits, but it also gives the evidence, right, that a program might need when it comes to patient experience and outcomes, right, with what they need to improve upon, right, and having that real-time data. I think even in terms of patients' rights, making sure, they'll make sure that it's 36 months typically of on-site assessments, right? And making sure that patient rights are posted, that they have access to those things. And what I appreciate about it is that it's voluntary, right? So you are not mandated to be CARF accredited or have a joint commission, seal of approval. Now, when it comes to some of the things that you might have heard or found in treatment with lawsuits or grievances, or something happened legally, all of that is still going through your local police department, right? And so they're making sure that everything's up to code and standard, and documentation is all well and in place, but it doesn't fully protect.
So there's CARF, there's Joint Commission, then there's state regulations,
right,
and federal regulations. And is some of this information you mentioned earlier, reviews, is some of this open to the public for them to see?
I have to cut that. I actually have no idea.
You have no idea. Well, let me say this. My sense is, the public can see if somebody's CARF or Joint Commission accredited. Right. So there's that. And then, there is other information the public can see, such as the reviews.
Right.
So, what are some of your thoughts about reviews and how they're sort of viewed?
Take them with a grain of salt. Right?
Take them with a grain of salt. Okay.
We can't forget that we're working in mental health and substance use, right? And so a treatment program, or 30 days, or even 6 months in a PHP, it's not a cure-all, right? There's no magic wand. And so what I pay more attention to than the reviews are the trends of the reviews, right? And so in doing treatment placements and navigating the right programs, I'm guilty. I'll look at all of the reviews, right? Like, I'll go pages back, but what I'm looking at is, one, are client reviews or family member reviews mostly. If you see 4 negative client reviews, right, back to back, and then you see an influx in positive reviews, right? All of a sudden there's 20, this program's the best, and shout out to so-and-so, and 5 stars. And they all say 2 weeks ago, 2 weeks ago, 2 weeks ago. I know that there was some type of incentive, right? And so a lot of programs might ask their admissions team, or, hey, we've had a couple of negative reviews, can you do us a favor and, write some positive ones? That's immediately a red flag for me, right, when I see that. I also think that if any program has 5 stars and thousands of reviews, right, I am skeptical. There is just no way that every patient was satisfied with their care, right? And not a single negative review landed there, right? So you're taking a look at, how did they get those reviews taken down? Yeah. So I say paying most attention to the trends, right? And if you might see something or catch something from a few different clients, whether it's a complaint about, a specific staff member or something, right? You might ask that on your, call with the treatment program, and ask them about those reviews and that person that you might be seeing listed. Instead of reading reviews or going that deep into reviews, Joint Commission, as we were talking about, right? Everyone who is through Joint Commission has outcomes and data, right? And so I would be asking, can I see your outcomes report, right? That's going to show you how many clients have left against medical advice, right? Perhaps what some of the patient experiences might be, or, any really good program has an alumni program. Can I speak to, alumni's family member or an alumni, and get more of that firsthand experience, because you just never know with reviews.
And so, right, as you're saying, take reviews with a grain of salt. What other things, if you can mention 3 things, should families be looking for when they're looking at choosing a program?
So I usually break it down with wants and needs, right? 2 buckets. What are the needs, right? And so we might have an individual who is struggling with substance use and OCD, right? Like, we know we need specific OCD, providers along with, addiction providers. We need to make sure that, his so-and-so's medications have been all over the place the last several years. We're not sure what's effective, what's not working, right? Like, how does the psychiatric care, right? And how are medications assessed at this program? Those might be 2 of your biggest needs, right? Let's say. And then wants, because some of that's important too, right? Do I want to be in the cold weather? Do I want to be in the warm weather? We can't say vitamin D doesn't impact our mental health in some capacity, right? And what electronic usage might be if you have somebody who needs to check into work here and there, right? Like, you have some of those wants, but I say really in interviewing programs, seeing how many of those programs or which ones can meet almost all of your needs, and then, going with some of the wants.
It's interesting to mention that, because I've often felt that it can be therapeutically valuable to go away, or therapeutically valuable to stay close, based off of the customization and what people need. And now you said what to be skeptical of, right? If we think about that, and of course you're saying anyone that has 5-star reviews, this is the best place, I've never had. What other things should families be skeptical of?
Do you want to stay here all day? No. Transparency. So a transparency across the board, right? So speaking first on ownership, right? So for example, I work for Sabino Recovery. TNR Recovery Group owns Sabino, right? That's Thomas and Roy. They also own Origins in Cypress and Texas, right? You can go anywhere on websites, LinkedIn. It's marketed TNR Recovery Group. This is our mission statement. These are our 2 owners, right? I am skeptical of any owners who do not list their entire business portfolios somewhere, right? So if you're going to go to one program, right, and you can't see that program is connected to any other programs, or they're not owned by the same organization or people, that makes me very skeptical, because you can isolate programs from negative impacts at other programs, right? And I also think it sort of waters down the mission statement a little bit, right? Like, you want to know who those owners are, what their mission statement is, what their purpose is, right? And it should be transparent. It should always be transparent. You should be able to find that anywhere that you're looking. I also think anyone who tells you we can waive that fee. To be honest, I mean, you'll deal with some treatment programs where it's like, you will waive the deductible. There's no getting around a deductible, right? Like, I can't go get my car fixed from an accident and not pay my deductible.
Right.
And then I think, again, goes along with transparency, not just financial, right? Of what does this cost at the beginning of treatment? What are we expected to pay? What are some unknown expenses that we might, we should try to prepare for or might expect throughout care? But is what level of care are you providing, right? And so there's a lot of programs that will sort of market themselves or will lead you to believe that they're residential programs, when in fact, going back to those levels of care, right, they're PHP or IOP levels of care with supportive housing or integrative housing, right? Again, those are great options for people, but let's be transparent about the level of care. So when you're speaking with a program or interviewing a program for your loved one, what level of care do you provide? It's a simple question.
And that's wonderful. And thinking about transparency and maybe hidden incentives, and sort of what's really happening, really helpful for families around a lot of these things, right? Around business practice, around clinical outcomes and things like that. Do you see upselling happening? Do you see places who have a low census saying, this isn't our sweet spot, but we'll do it because we need to bring in patients at the end of the day?
I think a really good question to ask any program, right, is who is a good client for you and who is not a good client for you. Base your feeling on the program on that response, right? If I couldn't tell you folks who are not appropriate for Sabino, right, then you would be skeptical of me, right? I could list a million different reasons, right? When it comes to upselling, again, it goes sort of back to the transparency and that ownership's portfolio, right? Of, you might have somebody who calls in for your insurance-based program, right? You get a sense that they might have some funds, right? And hey, I actually think you'd be a great fit for our concierge program or our, executive program. Very well, they could be, right? It could be the better option between the two for that individual who can afford it. But I think that's what I see primarily when it comes to upselling.
Yeah, I mean, it's, those, you've been in the field for a long time, and understanding that nuance is just invaluable it's really invaluable for families. What happens after discharge? So, what happens and sort of what happens from the family's perspective and also from the treatment center's perspective?
Right. So back to interviewing programs, right? And trying to find the right spot. Finding out what discharge planning looks like at the program that you or your loved one is going to, right? Is it starting week 1? Is it actually starting week 1, right? Is the primary therapist doing the discharge planning, or is it a separate discharge coordinator, which oftentimes is helpful, right? If the primary therapist is not wearing all of the hats, right, but just collaborating with. And it could look a variety of different ways. One of the beautiful things I think about the way our field is progressing is people are a lot more open-minded to different modalities, different types of care, right? Trying to keep a resident at home and building support systems around them, right? So they can, get back to whether it's a job or a family and finding some purpose in life again, rather than just, being a client, right? And so if we're back to levels of care, right, it might be stepping down from a residential level of care to a PHP level of care, right? If they don't have the, time to engage in a PHP program, we could be looking at outpatient, but we're supporting that, right, with, additional therapists, right? Or someone to a therapeutic coach or a life coach or a financial coach or someone to help navigate some of the other nuances that they might need support with after treatment. Yeah. But I think all in all, it's how do we keep this person in some type of connection, right? How do we keep them connected with people, with peers? Sort of back to that group therapy piece, right? There's a lot of power in community.
Yeah, I love that. Last question. What's the one piece of advice that families should walk away with from today?
That you have to do the work too, right? You can't put a client back in a malfunctioning environment and expect them to function, right? It's on you too. And I think also when it comes to all of these levels of care, the number one call you probably get and I get is, this all sounds great, but my loved one's not willing. And what do you do then, right? And it's back to that family support, right? And I think so many people are quick to jump to interventions, right? And taking things away and, getting them to rock bottom faster, right? So many families forget that they haven't even just had a conversation yet, right? What's going on? I've noticed this. Are you okay?
When I worked in addiction and substance use, we'd often say to our patients, we can't work harder than you.
Yes.
So, that's wonderful, advice to wrap up on, thinking about community, thinking about the responsibility, not just of programs, but also of patients and how they interact with mental health and addiction treatment programs. So, Erin, again, I'd like to thank you for your wisdom and your insight about mental health and addiction and finding the right programs. We're grateful for your time today.
Thank you so much.